那么今天上午的学术活动很精彩讲得非常的好。那么我们下午学术活动精彩的学术活动继续。那么第一位讲者我们很荣幸的邀请到了澳大利亚的我们王福训院士。那么黄院士的话呢，是吧？都是我们的好朋友了，在中国推广微创技术，特别是腹腔镜方面的话呢，做出了所有的贡献那我就简单介绍一下王院士的简介王福训教授院士目前是澳大利亚悉尼大学补充医学研究所健康研究所兼职教授，曾任澳大利亚新南威尔士大学利物浦医院教授兼院长，目前担任中国及亚太地区微创妇科肿瘤协会主席，他的奖项及贡献也很多我就不一一念了那么他今天给我们讲课的题目是妇科 NIS 的经验和见解。好，下面大家以热烈的掌声欢迎王院士讲课。
Thank you, Chairman. It's my honor to be here today and speaking for the Yanqi Summit. I'm going to share my experience and insight about this non-invasive surgery in gynecology. At the end of the day, I find myself mix up my slides, so if there's some up and down of my talk, I beg your pardon. I used to be a surgeon, open cancer surgeon. We remove big tumor by cutting the wound like that. And I managed to refine our surgery. Even for a big fibroid like that, I managed to remove it with a 7-centimeter wound without up and down incision, and the patient go home in 2 or 3 days. That's the minimally invasive open surgery. And I really thank you for some of the heroes in minimally invasive surgery, which I learned how they advanced their minimally invasive surgery. So it changed my journey, and from open surgery to minimally invasive surgery. I managed to write book, I managed to get award for minimally invasive surgery. Now, I'm going to share your experience of this, we call non-invasive surgery. The minimally invasive surgery is not without risk, even though it's very popular now. It seems that we move to an area, robotic surgery, and people will say, now it's much better. However, when I met Professor Wong and learned about this focused ultrasound surgery, in fact, I met him probably more than 10 years ago, and then later on in year 2016, come back to Chongqing and find what he had done. There's a surgery without losing any blood. There's a surgery without a scalpel. It won't hurt us. The most important, as they say, is for patient, our female patient who have fibroid adenomyosis, we can keep the uterus and we keep the reproductive function. And what impressed me is how quick the woman recover after surgery. I visited the hospital, managed to visit many centers in China. Each of the center operates more than 500 cases a year, and I learned from them, despite I'm near my retirement age. I find that there's an evolution in surgery And you see, what we are doing, laparoscopic surgery, the theater full of people. In HIFU surgery, and there's just 2 or 3 people, and that's it. And the patient is fully awake. Even under sedation, you can wake them up. Unlike those with minimally invasive surgery or open surgery, they need general anesthesia. And I'm going to introduce what I've done with HIFU. After I learned this technique, I set up my HIFU center in a commercial area. There's a business center, very busy. It's in the middle of the Hong Kong island. When I first started doing this, my friends always advised me, are you really sure? You better proceed with caution, because there's something, maybe hidden dangers, don't know, just like the shark underneath the boat. Now, this is my center, how it looked like. Movie, please. This is my center. Does it look like an operating theater? No. And this is the HIFU center, which I have. Very beautiful. My patient impressed with it. They come in, and I should put up the beach and with early sunset at the wall so that people will enjoy their bathing. And so this is a center which I have written and introduced it in a journal about this HIFU surgery theater design in a private clinic. It's not a hospital at all. There's no recovery room, no theater. There's just my clinic. And there's no operating light. The patient, really some patients scared about operation, and when they see the operating light, they are really panicking. But here, when you come to my HIFU center, and different lighting and make patient very comfortable. And my nurse is sitting next there quietly and doing some monitoring work. And see, the lighting is quite different. I remember a patient told me, whenever she entered the theater, operating theater, she's so scared because the white light, the operating instrument. But in a HIFU center, you can make it so comfortable. The patient will be amazed what it looked like. There's no operating light, there's no instrument. And I always invite the people, the mother or the boyfriend or even husband to come in to join in the operation. In fact, they end up looking how I operate rather than looking after their relative. The patient sometimes, you can see the last photo is that using a HIFU and telling people that she's having operation. So in this way, you can see they are not scared. They are really quite enjoy the process. So our visitor come to see me, and we discuss about the surgery, and we are just operating in front of a computer platform. For me, it's good. Despite I can still operating open surgery, minimally invasive surgery, I'm thinking when I'm getting old, even I get Parkinson, I think I can still operate with HIFU. Now, how it works, I believe many people here know how it works, so I'm not going to elaborate on it. When the HIFU started in my clinic in year 2019, what happened is the COVID come. For the next few years, my center become operating much more than a private small hospital. We operate in 2 years, 300 odd cases, and really, while the hospital, government or private, they are all closed for patients with COVID. I'm the only center that can open because I entertain 1 or 2 patients a day only. So we are not spreading the COVID disease. And the COVID, this really teach me a lesson. It's that the future development of surgery is not the operation room, because sometimes we may not be available. So we need to change our practice. And I've written 1 or 2 papers on how to cope with the COVID and the future. And of course, HIFU telesurgery is possible, just like our robotic surgery. My friend and I, we are looking at various ways we can deal with the COVID, like medical consultation and the HIFU surgery, and many of the virtual reality programs that tell the people what surgery are like so that they know what exactly we are doing. And my friend also, Professor Wong, already demonstrated first in year 2019, HIFU can do telesurgery. So as I'm near my retirement age, I think I better show this new technology to quite a lot of people. So I've started writing books and publish papers on really just on HIFU for this 2 years while it's COVID. I did encounter problem, really not really a problem, but encounter the issue using HIFU treatment. The difficult of HIFU treatment is that we are dealing with pathology, even though gynecology we are talking about this uterus only, but we are talking about adenomyosis, a fibroid. They are just not unique thing. The fibroid can have different size, different location, and the adenomyosis the same. The cases we have done more in gynecology, adenomyosis like this one, or fibroid. But the fibroid, if it's just a posterior or intramural fibroid, it's easier for us to do the HIFU. But what happened is multiple fibroid like that? Surely, we can ablate majority of the fibroid, but we will leave some behind, and they will come back. So it's also not uncommon that we are dealing with fibroid that might not respond to the HIFU ablation that well. We may have patients who have large fibroid, up to 25 centimeter in length. We have multiple fibroid. So there's one of the issues we may have to deal with HIFU. And also different type of pathology, degeneration, very soft, multiple fibroid. These are the ones we usually in the past deal with by surgery. All is well until now. We have HIFU. We are going to look at how we are going to solve this problem. We also, one thing, people always worry, will my case be a case of sarcoma? So we have to look at MRI carefully. We don't want to make a mistake. So these are some of the issues we have to deal with. To serve my experience is that, it's cases like many other too, even though we can ablate as many as we can, but there are some cases that were going to fail, like adenomyosis. The patient one, I did ablate majority of adenomyosis area, but it just come back. And the second one, it seems that I have managed to ablate it, but it seems that it doesn't stop, even though the pain have gone, but didn't stop the so-called heavy bleeding. So maybe it's because of my technique. So anyway, these are the issues when people starting to operating with HIFU. We will encounter this. So this one, and the ultrasound-guided HIFU, one of the issues, I must admit, when people come to see how I operate, they say, how can you see a fibroid here? That means our imaging is not good enough. So you have to be experienced to see there's a fibroid there, or where is the small fibroid. So, and as I say, the imaging is not good enough. Even though the way we want to find the non-perfusion volume, how much to ablate the volume, is difficult. And even though we can we have the contrast media, and to have the ultrasound contrast media, it only shows weekly the amount of the tissue you ablate. So not until you do it, and the MRI, you can show it, but MRI is expensive in our place. We can't do too often. So again, how to evaluate the effectiveness is another issue. Now, we all worry about complication. And then, even though we say, well, it doesn't hurt you when you put your hand between the ultrasound transducer and also the target point. However, you are just putting your hand in between the focused ultrasound and the target point. If, just like we go to the beach, when our skin is subjected to the sunshine at 35, 40 degrees, you have a sunburn. So that's why we have to be very careful about skin burn, because not only the target area are heat up, some of the area will be heat up, but even though it's not at 90 or 100 degrees, but it can be 40, can be 50. And also you can have gas bubble in between, you can have other things that will stop the ultrasound energy to go through. Just like when you have a scar in the abdomen, you can have skin burn, and you need to, might be 30-degree burn, you need to remove it. So for a patient who expected non-invasive surgery, you end up to have surgery done, no matter how minor surgery it be, and this is to the patient discomfort. So we need to select our patient. This thermal burn, and just like the MRI, after operation, you find this finding. So it can end up with the endometrial layer injury or the serosa layer injury. So this, the first one, can end up with infertility if the patient wants to have pregnancy, or end up with placenta accreta. On the other hand, the serosa injury can lead to aseptic inflammation and peritoneal pain and irritation. So this undesirable effect, sometimes we need to explain to the patient they are not really non-invasive. So sometimes we'll consider as minimally invasive too. And it all depends on the surgeon and the operation we are done, the patient we select. I have encountered complications of they are not deep vein thrombosis. Just a case that I will call to attend is that after HIFU surgery for adenomyosis, and then she developed bilateral ankle edema. In fact, we still don't find out the answer. It might be due to GnRH analog we gave before the operation. I have patients who have thrombocytopenic purpura develop up to HIFU. These are not the ones have been reported in the literature, nor are there enough books to tell us about this. So that's why I have shared with patients, or share with my colleagues with some case report. Unfortunately, nowadays, case report is difficult to publish because none of the journal will accept it unless you pay a lot of money. Now, evaluation of the effectiveness, hopefully, and I try to introduce the AI and able to evaluate the MRI pictures after that. And these are another direction we can do. Now, thermal burn, and I should put it earlier, and in fact, it's not only the abdomen that may have burn and a scar in the skin and the back. You may also worry why we keep the patient under sedation, because we want them to tell us if there's a pain at the back or the radiating pain, and because there's also ultrasound energy that pass through up to the target area and landing on the back of the patient. I try to use the infrared to show whether the patient suffer from burn, and in fact, it's quite useful. You need to use a very sensitive radio infrared, just like we are detecting the temperature. So for people who are really, even though they are under sedation, sometimes we still might have a heat hitting the nerve, and that's why we need to water the button more closely. And however, with this technique, I managed to say, hey, there's some white area, that means the heat is a bit high. I then stop. So it did help a lot, but it may not be possible for all type of disease. Now, various things, we still need skill and technique. The operation is expensive because of the equipment, and patients sometimes worry about the surgery, whether it can help. There's only a limited indication. And in gynecology, for the time being, we are treating more of other indications. But in surgery, we have reproductive surgery. We have surgery going to be doing correction, for example, congenital disease. We have surgery to remove cancer, not just ablation, we need a complete ablation. So there's a limited indication or application for the time being. We need to explore more indication. And whether it's effective treatment and can be able to make a diagnosis at the time of the treatment, and yes, we can, but we will be accurate. Can we foretell that this patient is going to have recurrence? We need to all sorts of information to help us to make this non-invasive surgery perfect surgery. Complication, we need to watch out. We spend a lot of time trying to avoid it. And nowadays, I'm thinking there are other areas that people are interested in. For example, histotripsy. They may be able to help us, not delivering the thermal energy, but able to do the mechanical ablation. They are using continuous energy. There's no thermal effect. They are just causing cellular ablation. So this effect, however, for it to treat cancer, it still there's some other alternative or combination of alternative. So I'm trying to look at the various ways we can enhance the treatment effect of HIFU. And microbubble is one of those. And this morning, some of the speakers did mention about could be nano technology, nanoparticles, and there can be really other things, for example, even bacteria, certain bacteria to change the environment of the tumor. In this way, can also enhance the HIFU effect. So HIFU have another properties that we are able to do this morning, and Professor David Cranston already talking about. It has the effect of sonoporation, that it opens the membrane of the cells. In this way, we can deliver drugs, we can deliver genes. These are the direction in research, and we are trying to apply to our treatment. If this is the case, then we may be able to help tumor that we cannot be completely ablate because of the risk involved of the heat spread. And so we talk about sonoablation to open the membrane so that drugs and genes can go through. So other thing is the imaging. If we are able to improve the imaging, make it much clearer. Now, MRI is one of those. We may be able to help, but again, it's too expensive, and not only the gynecologists cannot just do it. They need to work together with the intervention radiologist, and this way the expertise will be limited. So we need to improve our ultrasound, 3D ultrasound. We can look into various ways to improve the imaging, so to serve the purpose of image-targeted therapy. So one of the things I'm impressed with this treatment is not just how non-invasive it is. The world is full of all the waste, and the medical waste we are producing after surgery, after all sorts of intervention, then we need to clean it up. I'm so glad that the surgery I operate in my clinic doesn't need to clean up all the medical waste. All the medical waste are difficult to dispose, and also it affects the environment. So when more and more this type of surgery can be performed, I think that will help the world by a clean world. So I probably just quickly go through it. In gynecology, we can deal with abdominal endometriosis, placenta accreta, and cesarean section scar pregnancy. Why I mention all that? Because we need to develop more indication in our HIFU treatment. In this way, it will expand the interest of our colleague to deal with it. So besides this, the machine, we should modify it. We may be able to develop a smaller and smaller machine. For the time being, the machine is too expensive. If we may be able to develop just like the small HIFU machine and to treat different indications, that's good. I mean, in this way, everyone knows what is HIFU and they can use it to treat different indications. And this is the small HIFU that's going to treat, for example, the HPV infection and the CIN, early CIN, even late CIN. In China, they are starting to accumulate quite a lot of experience in that. I think that will help our gynecology in treating some disease. And the cervix up to the ablation and can heal perfectly, unlike the lip or cone biopsy. And again, vulval dysplasia and leukoplakia is again something that have been known for a long time that HIFU can produce a very good result in this group of patients. So I do believe what we are doing, just like in those days when we introduced laparoscopic surgery in our gynecologists, and we encounter a lot of problems too. We encounter poor lighting, and we encounter poor laparoscope. However, we are developing into a worldwide practice in minimally invasive surgery. I do think we are moving to a new direction of treatment. There's the focused ultrasound surgery. So hopefully, with AI, with robotic, and able the technology making a smaller machine, we can all enjoy operating with this non-invasive surgery. So thank you very much for your patience. And
好，非常感谢我们黄院士精彩的授课。那么黄院士的话呢，从事我们妇产科工作将近50年啊，他就是我们见证了我们妇科手术的一个革命的一个历史，从我们传统的开腹到腹腔镜微创，到现在的微无创，是吧？就是他讲课的这个 NIS 是吧？No Invasive Surgery 是吧？所以呢，他推崇了这些理念，他用大量的案例给我们讲解了海扶刀在子宫肌瘤、子宫腺肌症等等，还有包含异位妊娠这些的话的安全性、有效性那么我认为海扶这个刀是一个我们妇科微创的一个历史的革命性的这个意义。它既有这个安全、有效、值得信赖的这个技术，同时王教授的话呢，也对我们未来也展示了在妇科其他领域的一些应用刚才他也提到了是吧？在宫颈疾病HPV 的感染，还有外阴的疾病，特别是白斑方面，也具有比较好的疗效，值得推广扩大适应症。好，我们再次热烈掌声感谢王院士精彩的授课。